Still on the anterior compartment of the thigh, the muscle group that is found here belongs to the Quadriceps Femoris group of muscle. Please do not confuse that with Quadratus Femoris. Quadratus Femoris is a single muscle. Quadriceps Femoris, that's a group of muscle found in the anterior compartment of the thigh again. This most anterior and medially located muscle. Also, it's the more superficial compared with the other muscles of the group. That is the rectus femoris. This muscle right here, that's the vastus lateralis, the vastus medialis, and deep to the rectus femoris is the vastus intermedius. These nerves are just the cutaneous nerves to the skin and subcutaneous region of the thigh. The group acts as a powerful extensor muscle to the knee, and proximally they also help flex the hip joint. Some of the muscles, but mainly they are knee extensors. Clinically, the vastus lateralis, we can use that as a site for intramuscular injection. It can receive or accommodate a large volume of injected drug. So just like the gluteus maximus, we can inject greater than 5 ml of drug into the muscle. So we're looking at the iliotibial tract right here, where the tensor fascia lata is attached. The iliotibial tract is the lateral thickening of the fascia lata. Again, the fascia lata is supposed to surround the entire circumference of the lower limb. It is also described as a thick or tight fascial stocking. Tensor fascia lata, when it contracts, it pulls on the iliotibial tract. You can see where the iliotibial tract is attached. It's attached to the tibia. So tension or contraction of the muscle up here tightens or pulls up the iliotibial tract, then it will contribute to knee extension also. One of the mechanisms which allows us to lock the knee into place, to support the upper part of the body when we are standing up, especially if we stand up for long periods of time. Also, we were talking earlier of the fascia lata and also the compartments of the thigh. Extending from the fascia lata, going to the linea aspera of the femur. Linea aspera of the femur is a sharp ridge at the posterior aspect of the femur. And the femur is the long and large bone right here in the thigh. Extending, coming from the fascia lata and extending towards the linea aspera are 3 fascial septa or connective tissue septa that will physically isolate or separate the 3 compartments of the thigh. We have a specimen that will show us a cross-section of the thigh, and we will point out those connective tissue septa. Okay, let's move right here. Let us now identify structures that occupy the medial compartment of the thigh. Medial compartment, we can also call this as the adductor compartment, because the hip joint adductor muscles are found here. The most superficial right here is the gracilis muscle, followed by we have here the adductor longus. Right behind that is the adductor magnus, and in the more superior part, not clearly visible at this point, deep to the adductor longus, we have adductor brevis. This muscle right here, that's partly the pectineus actually. So we'll look for the adductor brevis in another specimen. So earlier we were talking about the subsartorial canal. So this is the actual space for the subsartorial canal. You can see the distal part of the femoral artery. At this point, the femoral artery will pass through a defect or opening in the adductor magnus muscle, which is called the adductor hiatus. So coming from its anterior position, the femoral artery will cross the adductor hiatus to become to cross the posterior compartment. As it arises through the adductor hiatus going to the posterior compartment, it now becomes the popliteal artery. We cannot clearly see that in this particular specimen right here, but we have another plastinate where we can trace the femoral artery and its course. And alongside the femoral artery again, that's the saphenous nerve. By the way, the primary nerve supply to the anterior compartment structures is the femoral nerve. While for the medial or adductor compartment, the primary nerve supply here is the obturator nerve. Although we cannot see the actual branches of the obturator nerve going to the medial compartment muscles, but let's try to trace again the obturator nerve. You can see it right there alongside the obturator artery. So in the thigh region, we follow one compartment, one nerve supply, one blood supply rule. So anterior compartment, nerve supply, femoral nerve, blood supply, femoral artery in its branches. And then we have the medial compartment. Nerve and blood supply will be obturator nerve and artery.